SCHIP, as you know, was started about 12 years ago, and we're heralding the fact that we have this expansion that was signed about a month ago. But I was actually involved in the original program at the time 12 years ago, and it was bipartisan. And the idea was that if you look at the uninsured, the largest group of uninsured are children, which amazes people. They say, how can that be? Unfortunately, you could write maybe 12 volumes on how in this country we neglect children. And I know it's sad to say, but I always feel that the reason is because they don't vote. I know it sounds so crazy, but you'd think that there would be a natural constituency or political pressure or whatever you will for children. But I think because they don't vote and they don't actually have advocates, obviously those of you who are here are advocates, there's always been a neglect of children in our system, which is amazing. But again, they're the largest group of uninsured. So we decided 12 years ago that if we did some kind of a match with states and we sent money back to the states and from the federal government, they would match it, we could cover a lot of kids, and that started the SCHIP program. But what happened is over the 10 years that it was authorized, we covered, I guess, about 7 million children at any given time. But we knew that there were almost twice as many out there that didn't have coverage, and most of them were eligible. Most of them were eligible for the program. They met the income and other criteria. But unfortunately, we didn't have enough money to cover them, and we needed more outreach. So that's essentially what the SCHIP bill does. It covers about another 4 or 5 million children through a tax on tobacco. I was in the 7-Eleven yesterday, and I noticed the sign went up, buy all your cigarettes now because the tax goes up April 1st. And I said, well, there you go, it depends on your perspective here. But in any case, we will now have enough money to cover maybe another 4 or 5 million children. But I was talking to the Family Resource Center, I think that was the group that we were taking pictures with before, Family Support Center of New Jersey. And, we were talking about outreach because even though we have this pool of money now, we have to get the kids signed up. And the other thing that the SCHIP bill does is it provides a grants, if you will, to nonprofits. The Family Support Center probably could, one of the ones that might be eligible, that they would use that money to go out and sign kids up at, however best they can. So that was a very important aspect of it.